Hello, I am Denise Dwaji, the Research and Policy Officer at Future Care Capital, and I would like to welcome you to today's webinar brought to you by Mencap in partnership with Future Care Capital, where we are aiming to introduce you to the idea of how data analytics can shape improvements in the current social care system. Future Care Capital is looking to raise awareness about a new framework for implementing data analytics in social care and grow a community where people with a shared interest in social care can apply this framework, while Mencap is going to talk to you about a specific and inspiring example of how data analytics can improve the lives of people who benefit from social care, more specifically, people with learning disabilities. Thank you for taking the time out and being here today, and we are hoping that this event will help you find inspiration and motivation to contribute to the field of social care analytics. That being said, let's get started by introducing you to the community of practice for social care analytics brought to you by Future Care Capital. Next slide. Our community of practice has the mission of bringing together people with a shared concern, passion, and professional interest for social care and data. This is what, in technical terms, is called a domain. We also have a platform where data analysts, academics, care providers, carers, and policymakers are building relationships through discussions. And each of these people are bringing practice to the table. We have data analysts who are developing tools, academics who are continuously researching the best methods to implement such tools, and care providers and carers who are actually implementing these in real world settings. The end goal of bringing these three core concepts together is to promote shared learning and collective action. Next slide. So I mentioned we have a platform that facilitates group discussions through multiple threads where people ask specific questions or start discussions on specific topics related to social care and data analytics. We also have threads where our members discuss policy developments and showcase events. And we have a newsletter that keeps people up to date with everything going on in the community. But we are looking to rebrand and make our community more than a discussion forum. We are looking to have a platform with multiple features that support collaborative learning and decision making, as well as the organization of purposeful action. Next slide. The framework that I developed for this involves idea generation through a similar process of group discussion and research sharing that we have in place, but also involves teaching data analytics through online courses and maybe having a GitHub repository for useful tools. I also envisioned using research methods to make the community generating content available to policymakers and also involving people with lived experience in the decision making process. That would include both carers, paid or unpaid, and people with lived experience of needing social care. And this is purposefully vague for one reason. Next slide, please. I would like you to have a say in our story, to share your opinions and suggestions on our rebranding initiative and new framework. Tell us what you need, the changes that you want to see in the field. For this, please join the community. The link is here, but if you find that impractical, just Google Future Care Capital Social Care Data, and I promise you'll find us. And please contribute to our threads on understanding the lived experience of people needing social care and suggestions for rebranding the community of practice. We would be hugely grateful. And now I'd like to hand over to Zach from Mencap, who is hopefully going to convince you about the power of data analytics for improving the outcomes of people needing social care. Thank you.
The presentation, please. Thank you. Move to the next slide, please. Thanks. So I'm Zach. I work for Mencap as the Director of Quality and Practice, and I'm going to start our conversation about data and quality of life by talking to you a little about quality of life and what it is, and then talking to you about the personal outcome scale, which is abbreviated to the POS. So can the next slide, please? So quality of life, kind of start with kind of why quality of life is important. And I think it's really significant that we start with this. So quality of life is a way of looking at and understanding the experiences of people that all people have, not just people with learning disabilities, but all people. It's worth thinking about because if we know about the quality of a life a person has, then we can think about the things that would make that better. And the idea of quality of life in itself is not just, sorry, my screen just jumped. It's not just as a measure of success. So you can use measures as kind of tools around quality of life, not just a measure of success, but as a way of helping plan the work that is to come. So thinking about what would be next. There have been other ways of looking at this over the past. So satisfaction has been a common way. This is different to satisfaction because it looks beyond what people could be happy with, and you can be happy with very little. So the idea of the quality of life is universal, and it's something that applies to all of us. But thinking specifically about people with learning disabilities, there's been some previous comparison of data for people with learning disabilities about quality of life with the broader population, and it is evident that people don't have such a good quality of life. This has primarily been in the Netherlands. And so one of our pieces of work and one of our focuses is about making sure that we address that both at an individual level so that the person themselves that we're working directly with, but also at a societal level that people with learning disabilities have access to an equal and improving quality of life. Can the next slide, please? So the personal outcome scale, which is the tool we've been using, is a tool that was developed by Ghent University. So it's been developed in Belgium, and it was developed in partnership with a provider organisation called Arduin in the Netherlands. It's based on a model by Sherlock, who is an academic from the US, and his model of quality of life, of which there are 8 domains, which are here on the right hand of the side of the picture. And Sherlock says that those 8 domains fall into 3 factors. So you can think about people being independent, people participating, and people's well-being. The tool itself was created rigorously. So it's created through a process of research. So there's academic research done, and then testing of the factors that they came to, the questions they came to. They then took that to specialist panels. They then tested it with groups of stakeholders, including people with learning disabilities, their families, and the people who support them. And then they took it back to reduce the number of elements within it. They brought it from, I think it was nearly 200 originally, down to 48. And then they tested it again, and they came to the tool that we use today. The tool is made of those 48 questions, and each question has a 3-point scale. So those are kind of yes, no, or an often, maybe, or sometimes type answer. It doesn't just ask for that 3-point scale, and importantly, it asks what could make that life better. So it's very significant. Ask what could be better in that person's life, and it asks the person to think about that over the previous 12 months. Recognizing the difficulty that some people with learning disabilities may have, or people with communication difficulties more broadly, the tool can be done as a self-report, which is ideal, which is with the person themselves, or it can be done with a report of others, which is with the people close to them. If you're to use a report of others, then it's really important that you use 2 different reports so that you get a triangulation of data. Okay, could I have the next slide, please? So how are we going to use the POS? So we've recognized the POS itself is a measure primarily. That's what the tool was designed for. But in the way we've been using it, the way it's designed, it is also a form of intervention. So the tool asks about the quality of life of the person. It asks them to think carefully about their life, but it asks them to think about the outcomes that would lead to a better quality of life. And so in doing that, the person undertaking the interview records the conversation they've had. And in doing that, the person identifies what could come next. It's really important because it's the way we've been using it is reinforcing the role for the need to listen to people with learning disabilities and to find out what's important to them, as opposed to for people to assume that. And it makes you step back and stand quietly and pay attention only to what people are saying, and don't try to fix people's lives, and give people the opportunity to tell you what's important to them. The way that we've taken to using it is both as a measure and as a planning tool. So the tool itself is something we complete once a year, and we're using it at the start of that year, and then we're reviewing it at the end of that year. So we can use it to understand what someone wants to achieve in the year, the outcomes they want to do, and then we can come back and evaluate whether that's changed. As a tool for an organisation, it alone wouldn't be sufficient to help us understand the things we've done and the measures we do, other alternative ways of working that we've used that support the quality of life or improvement in quality of life. And so we'd use this alongside measures of quality of service, which are more of the compliance and process pieces, and measures of quality of practice, which is a kind of a more broadly about satisfaction, the way that we're supporting people. At the moment, we have a smaller number of people who've used them, but the intention is that we get increased numbers of people who've used the tool. We can increase the learning that we glean from that data, and that we can think about the things that facilitate and help predispose people for a good quality of life. And then most importantly, we're looking at how, for me anyway, how we can use the pause to raise the expectations of people so that people expect more from their life. I think I'd like to hand over to Ellen now. I think that's me finished. So next slide, please. Thank you.
Good afternoon, everybody. So my name's Ellen and I am the Programme Manager for Quality of Life within Mencap. So I take the lead on this work, and I'm going to talk to you a bit about the practicalities of how we've used the POS and some of the things that we've already learned. Can I have the next slide, please? So as Zach mentioned, this is an interview tool, and it is a tool that people need to be trained in. So we can't just take the questions and go and ask people. It's really about having that conversation and being able to really listen to people in a way that maybe they aren't used to being listened to. So this is an overview of the training that we give to interviewers. So for day one, which we've currently been doing online since the pandemic, we cover the theory of quality of life. So a bit more in depth than Zach was talking about in the introduction there. The theory of the POS, so where did it come from, how it was developed, but also how within Mencap we've tested it and piloted it. And then the real sort of core of that day is around the interviewing skills. So what makes a good conversation? How do we check that people are really understanding what we're asking them? And how do we make them feel comfortable? It's all about getting to know people and making sure it's a two-way conversation. We don't just want to be bombarding people with these questions. We want to really listen to what they're telling us. And we do a practice. So we always have at least one co-trainer with a learning disability on these courses. And they talk a bit about their experience, but they also let the people that are being trained practice asking the questions and give some really good feedback and some really insightful feedback about how it feels to be asked those questions, which I think is really important. And then on day two, which we do in person, and again, I think that's really important because it can be difficult to have these conversations over Teams or over Zoom. We spend the majority of the time doing some practicing and some observations. So the trainers will observe the people that are interviewing. And also we get the people interviewing to observe each other and to learn from each other's practice. And again, that's always done with co-trainers with a learning disability. They give some really insightful feedback and some really honest feedback, and there's some feedback on the screen there from one of our co-trainers, and I think this is the thing that I heard that most made me feel like this piece of work is so valuable, in that actually for him it's about his quality of life is better if he knows that people with a learning disability's life is also getting better. And if you go and do one interview tomorrow, you've actually potentially improved two people's lives. So the person that you're interviewing and Stuart, our co-trainer. And I think that speaks volumes, that actually this piece of work has that individual outcome, but it also has that in sort of wider societal outcome, which is really important. After the day two training, people are signed off as interviewers, but the support continues. So we offer regular refreshers, buddying systems and observations to keep the learning live and to make sure that we're keeping that quality of conversation up. In addition, we've got POS trainers across the organisation. So to become a POS trainer, people need to complete 20 interviews, and 3 of those are observed by a master trainer. And again, that just keeps that quality up, to making sure that we're providing really good quality conversations for people. And a master trainer needs to complete the 4 sessions, so 4 training sessions, as well as the 20 interviews and the observed interviews. Can I have the next slide, please? So this is talking about how we link what we're doing to our internal system. So we've got a system called What Matters Most, which is a way of working really rather than a system. It's a way of thinking about people's support in a really person-centered way. So following the interview that people have, they receive a report that's got all of their qualitative and quantitative information. So it's got the scores, as Zach was talking about, from the Likert scale, as well as all of that really rich data that they tell us about what they want to achieve. And then this is used by the teams to update their outcomes, their support plans, their one-page profiles. And there's an example there about a young lady called Priya, who was feeling really sort of out of touch with her culture. She didn't feel like she had enough engagement with her culture, and she really wanted to improve that. And that came out in her first POS interview. And she spoke really clearly about some of the things that she wanted to do. So following this, the team supporting Priya were able to find out information about things that she could attend. So she attended an Indian food event, she started going to some Bollywood classes, and she's just more involved in cooking food of her culture. And that's had a really positive impact on her quality of life, not only in terms of learning lots of new skills, but also the social inclusion that comes with that, and her overall happiness has been enriched as well. So you can sort of follow that journey from the interview to the outcomes to the sort of evaluation at the end of that process. And it doesn't stop there. We then go back and we generate new outcomes, and we continue to support Priya in this way through her life. Next slide, please. We have faced some barriers in terms of the pandemic and some of the practicalities around this work. As I said before, it can be quite difficult to do via Teams or via video call. So we have needed to move to new ways of working. And unfortunately, we didn't meet our target of hoping to interview 1,000 people by March of this year. And actually that was less than what we achieved was less than the original target we were hoping for. There were several reasons for this. So in the initial sort of first stages of the pandemic, people's work was prioritised to keeping people safe, to managing some of the difficulties that people were facing around lockdown, and that needed to be prioritised over some of this work. And then as that moved forward, we found that people found it really difficult to engage via online technology. We had to postpone quite a lot of training because we needed that one-to-one face-to-face session, and risk assessment wise, it didn't feel like this was an urgent piece of work or an important piece of work in the same way that maybe first aid needed to continue. So we had to prioritise other things. The impact on interviewers was obviously quite high as well, because the impact of COVID on their workload meant that they just didn't have the free time to go out and do the interviews as much as they like, or perhaps they had interviews booked in that had to be cancelled last minute because of an outbreak or because of somebody being unwell. And equally, the impact of COVID on staffing in our services meant that we couldn't call people out for training some of the time because actually they were needed to keep the services safe. Next slide, please. Despite that, since we've relaunched the project in around about March of this year, where some of the pressures started to ease, we've had lots of really positive feedback. So we're starting to see that managers are really benefiting from some of this work that we're doing. And there's a quote there from a service manager in Hampshire who was part of this project. And you can see in there, it's a chance for people to talk about the things that really matter to them, and a chance to be listened to and to have their lives sort of looked at in a way that means that we can see the positives for how people can achieve their personal outcomes. Each of the interviews does take about an hour and a half, and we do have some feedback from people who maybe aren't familiar with the tool that's quite a long time. But actually what we find is that this is a really positive impact for the people being interviewed as well as the interviewers. Quite often the people being interviewed haven't had a chance to have a one-to-one conversation of that length of time for quite a long time, and they really benefit from having that sort of one-to-one undivided attention where the person talking to them doesn't have to worry about the other sort of pressures of support that are going on around them. And I think it sums it up there that actually the experience is positive and engaging, so I think that's really positive. Next slide, please. This is another case study that we've looked at. So this is a person called Stephen who had, he's between 2018 and 2019, he suffered from a stroke. And we'd been out to interview him in 2018, and his scores were indicative of his life at the time. He was quite active, he enjoyed getting out and about, and he was fiercely independent. And he then had a stroke in 2018, which obviously had quite a big impact on his life. But the team supporting him were also concerned that he was suffering from TIAs or mini strokes. And the doctors and sort of community teams weren't really engaging in finding new ways to support this person. They argued that if he was having TIAs, they weren't having a big impact on his quality of life. So we went back to interview him and talk to him in 2019, and the scores there obviously show the impact that his health changes had on him. You can see, especially in terms of social inclusion, there's a real big difference in his scores there, and his sort of total quality of life score has really dropped as well. So we were able to use this as evidence to challenge the doctors and the community team to really look at his treatment and to look at his sort of diagnosis. And fortunately, they did do some further investigations, and he was diagnosed as having TIAs or mini strokes. And some treatment was put in place, and also some additional hours to help him to regain some of the skills that he'd lost because of the health changes. So that was a really positive outcome. Ideally, we'd have liked to go back and speak to Stephen again since then, but unfortunately, due to the pandemic, it hasn't been able to happen. But from what we hear from Stephen and his staff team is that actually that's had a really positive impact on his quality of life, and we're looking forward to going back and doing that interview again and finding out what's changed for him. And next slide, please. So I'm going to hand over to Owen now, who's going to talk a bit more about the data and the analytics. Thank you.
Hi there. Thanks for that, Ellen and Zach. And I would put out to any listeners out there, do submit some questions via the question submissions we've got some at the end. You can have a look at them. So my name's Owen. I'm the Insight and Analytics lead at Mencap. And I'll be talking a bit more from a kind of technical and data perspective. If any of this doesn't make sense or you want to query, then do submit a question. I can get back to you at some point. So what Zach and I have been talking about is the difference of using a POS conversation for the individual, for building that support plan, for making a difference in an individual's life. But what we can also do is start to look at the data from a societal level, as Zach mentioned. So what are the facilitators of good quality of life, and how can we find those? So as we do these individual conversations with people, as we have these conversations, then we're also producing data. We're producing data about what might make a difference to people's quality of life. Next slide, please. So this work itself was funded by the Health Foundation, who opened up a funding program called Strengthening Social Care Analytics. And we applied for that. We'd already started with the POS, but what this funding from the Health Foundation allowed us to do is to kind of really engineer the data so that we could get a solid data platform. And what they were looking for this is to help the social care sector respond to COVID and its aftermath, and see how data analytics can be used to improve social care. So there's sort of three main outcomes they were looking for: to improve the quality of social care, particularly for those experiencing poor outcomes, to build a safe and resilient workforce, and to understand the lived experience of people needing social care. And I think you can tell from what Ellen and Zach have said already that we're really trying to understand the lived experience of people needing social care. And with this data set, we can then start to look at improving the quality of social care, either from a practice perspective or from a societal perspective. So can we notice differences and facilitators and changes and correlations in quality of life scores for things like the type of setting somebody lives in, underlying health conditions like the example that Ellen just gave, specific support interventions, anything like that? We can start to lay over different data sets, where someone lives, their geography, whether they live in a village or a town, all of these kinds of things, and see if we can then robustly look at, are these things associated with quality of life scores? Next question. Next slide, please. So the funding allowed us to build an analytical platform. And what I mean by that is engineer the data through pipelines into a place that where we could analyze it. We were quite keen from the beginning of this project, talking about building platforms, not projects. So we don't want necessarily to do a piece of ad hoc analysis. So we could have done that. We could have gathered some data, looked at some correlating factors, and then had some information. Not all the information we might have hoped for COVID, but we'd have some information. But how we've approached this is to build a platform that we can reuse and reuse as we have new questions, as we bring new data. So on the left here, you can see the various sources of data. So the way the pod interviews are conducted is we have a mobile app where the interviewer can submit the data back. We also have our What Matters Most app, so the quality framework. And what we're doing is engineering that data into a central store in the cloud, alongside other contextual data. So details about the setting, demographic details, and eventually getting into open data. So looking at things like deprivation of an area, or perhaps urban rurality. So other things that we can layer on once we've got enough data in. And then the outputs from that, we're looking at producing dashboards to help people do their roles, to help Ellen specifically. And then also using a piece of software called Databricks, which is a cloud-based analytical system using something called notebooks, which I'll come back to a bit. And we're able to then to iterate through different analyses. Next slide, please. So this is one of the first outputs that we came up with from a data perspective. So this is a dashboard. This screen grabs from a little while ago, so the number of completed conversations has gone up more since here. But this is an operational dashboard to allow Ellen to do a job, to see what conversations are happening and where, to see how many are in the pipeline to come up in the future. So the top left there, we can see the number of interviews and the number of interviewers, people interviewed, I should say. We've got a funnel of people coming through, what kind of roles people who are doing the interviewing take, whether they're self-report or other reports, and then cumulative conversations in the top right. And you can see that big flat line there is the pandemic. So the number of conversations is really, really slowing down. And glad to say that's taken up a lot more than it looks like on this particular screen grab now. Next slide, please. And we're also able to dig into the scores themselves. So Zach mentioned the technicalities between report of self and report of other. So report of self, somebody answering for themselves, and report of other, people answering on behalf of somebody. And they score quite differently. People, when answering for themselves, answer questions in a certain way. And when people are answering on behalf of somebody, they tend to be asked in a different way. So when we're doing this data analysis, we want to separate those two things out because they have different average scores and different distributions. You can see here the two distributions present in that. We can feed that again into the dashboard and use it to develop evaluation and monitoring frameworks more across Mencap. We'll start to use this data again and again. So the great thing about this project is we'll be able to reuse this data in different sort of parts of the organization. Next slide, please. So as an example of some of the questions, these are the 6 questions that make up the choices domain. I won't go through all of them, but Zach talked about the Likert scale. So question 23, for example, do people respect your decisions? And that could be always, sometimes, rarely or never, or no answer given. Always would score a 3, sometimes a 2, rarely or never a 1, and no answer given a 0. And then we take those 6 questions and we could total those up to a total score within choices. And then if you took the 8 domains and totaled all those up, you'd come up with an overall total score. What I found as I've gone through is I want to look initially at domains of themselves rather than total scores, because I think that'll be a bit more interesting in the short term to try and draw out some insight rather than looking at the big total score, although it is valid to use the total score. Next slide, please. So here we can see distributions then within those different domains. So rights, money, social inclusion, learning, health, happiness, friends and family, and choices. We've renamed some of those domains from the model that Sherlock originally had to match our What Matters Most framework. So if you've seen 2 versions of those domains during this presentation, that's the reason why. Next slide, please. So how we're doing this? We're doing this with notebooks. So a notebook is a way of running analytical code. What I really like about them is they combine narrative and code into one document. So it allows you to do data cleaning, statistical models, machine learning models, data visualization. What you're doing is you're bringing data, code, and narrative together into kind of an interactive story. And what's really good about them as well is they're reproducible. So if I was to do a piece of analysis in Excel, every time I make a change to that data, it's a destructive edit, as it were. With reproducible analytics, we can go back and run the same instructions over the same data using the same code to come up with the same output. And we can update it as new data comes in. I can share it with other analysts in the team. So we've got the building blocks to be able to do the same type of analysis again and again. And I'll come on to an example of that in a second. It's also open source, so there's new stuff being developed internationally that we can use. There's code examples all over the web about how to do this kind of stuff. So a really positive way of working with analytics, and with this particularly. Next slide, please. So as an example analysis, there's a lot of information on this slide, so I'm going to summarize it, but people can ask me any questions later. We're looking at total health score. So overall, what's somebody's total health score, and then splitting that down into subgroups based on self-report, other report, and based on specific reports, supports people have based on any underlying health conditions. So somebody might be supported to take the medication. Somebody might be supported with diabetes or speech and language therapy. So then can we notice differences in the total health score between people who are supported in that area and people who aren't supported in that area? So for example, is somebody supported with taking medication, or they can take medication themselves? Is there a statistically significant difference between those two total scores? And for the most part, with the amount of data that we have in so far, 7 out of 9 of those areas, there's no statistical difference. There is for diabetes, for people we support who are reporting on behalf of themselves, and for speech and language therapy, for people who are report of other. So this is interesting, and we might find these numbers change. I need to run another statistical test over this to correct some of it. But it's a really good platform then to be able to do these analyses. And looking at what Ellen was saying around social inclusion and that example with Stephen, I showed this to Ellen and she said, well, this is great, but can we see if underlying health conditions make a difference to social inclusion? Now I can rerun this piece of analysis with 2 words changed in the code, and then we've got a different analysis that we built from that same code base. So it's a really exciting way of working. To be able to have this kind of experimentation platform that we can go back to, especially as we have more conversations. Next slide, please. So next steps for myself, we need to increase the number of conversations we've had to be able to do some better analysis and to do some more kind of interesting analysis. We need to change the underlying data model to better handle the second measures and third measures, so the conversations that happen years afterwards. So the underlying model needs to get a little bit better with that. But then once we've got that, we've got longitudinal analysis, so we can see what changed. And I think that becomes powerful. At the minute, we can look at facilitators' quality of life, but we don't know necessarily what happened between those 2 events. So we can start to see what interventions, support plans, what somebody might have done with their lives, whether they're achieving all the things that they wanted to achieve. We can start to look at that, and that becomes a really quite powerful way of looking at things. So then once we've got more conversations in, we can implement analytics beyond inferential statistics, and then continue to use natural language programming to look at topical thematic analysis, which is where I hand over to Gillian.
Thanks, Owen. So hello and welcome to my presentation on using text analytics with the personal outcome scale at Mencap. So for the next 10 minutes, I will talk about why it's important to analyse text data at Mencap, especially from the pause, and I'll also describe how natural language processing techniques, or NLP, can make working with text a little easier. So I'll first talk briefly about the structure of the open-ended questions that form part of the personal outcome scale conversations, and I'll then discuss how text pre-processing techniques are used to help clean and prepare the data for further analysis. We'll also look through some examples of the exploratory data analysis performed on the pause text dataset, and then finally I'll reveal some of the insight extracted and what this means for Mencap. Next slide, please. So why bother analysing text? Text data is unstructured, it's messy, and it's typically time-consuming and difficult to analyse. It's not uncommon for researchers to spend hours reading through the responses to open-ended questions, line by line, and manually coding or labelling and organising the data to try and find patterns and themes. It's typically a labour-intensive task. Before I started at Mencap, work had already commenced on analysing the quantitative data, which Owen has already talked about, but I was immediately interested in the text, and although NLP techniques are typically applied against big data or much larger data sets, I was keen to see if I could extract any themes or patterns using some simple NLP techniques. Next slide, please. But before I talk about text, here are some numbers first. So the PAUSE data set that I used was collected from 369 conversations with people we support at Mencap, and this comprised around 8,500 sentences and 154,000 words. Next slide, please. So qualitative data is valuable. It can be used as anecdotal evidence. I knew that the qualitative data would be valuable to Mencap at an individual level for helping to construct individual support plans, but I was interested to find out what we could learn at a macro level. What patterns or themes would appear across the whole data set? What if I was to focus in on a specific domain, for example, like learning? What do the people we support at Mencap say that they want to learn? Next slide, please. Before I talk about the process of preparing the data for analysis, let me explain about the structure of the PAUSE open-ended questions. So each PAUSE conversation includes 4 open-ended questions per domain. So this provides 32 free text responses available to analyse per person, although the answering of any question is not mandatory. The questions are all structured around the concept of what would you like to start, stop, or keep doing. For example, if it was the domain learning, the question would be, what would you like to start doing in relation to learning and personal development? Each domain then ends on a question asking if there are any other comments they want to note. Next slide, please. But before I can do any thematic analysis, I need to deal with the messy text data, and I need to prepare it specifically for text mining. This preparation process is known as text pre-processing. It cleanses and organises the text into a form that the computer can then process. So first, dealing with the messy text. When I looked at the free text comments, it was immediately obvious that it would require careful cleaning. Careful because I don't want to remove any meaning from the text, but I do want to remove extra white spaces, extra characters used as bullet points, and correct very obvious spelling errors with a light touch spell check. I found that when the data was collected, there was more than a dozen ways to represent saying nothing at all. So none of the PAUSE questions are mandatory, and often the person chose not to answer or had nothing to say, but when the data was collected, there was no consistent way to state that. So I had to standardise those responses. All of these small cleanups are necessary to help the machine to be able to deal with the text. It essentially removes noise from the data. Once the data is cleaned up, I can then move on to the next stage. Text pre-processing is an iterative process. It typically involves some or all of the steps shown on the slide. The objective of this phase is to get the text data into a form that optimises the ability of a machine to handle this type of data using specialist text mining packages. Next slide, please. Now that the text data has been cleaned and some of the noise has been removed, I can move towards extracting some insight. Performing exploratory data analysis helps me to understand more about the responses and to see if any initial patterns start to emerge. The slide shows 4 different methods to analyse the data. So there's part of speech tagging. I went looking for nouns to help drive out specifically what people were mentioning, and we can have a look at that next. You can also look for different parts of speech, verbs, adjectives, etc., and any combination of these. I also looked at bigrams and trigrams. So these are looking at pairs of words or any number of words in succession. Sometimes these can reveal a greater understanding and provide some context to the insight. Word clouds are a popular visualization to use with text. They're a quick way of trying to draw out themes based on word frequencies. They can also be used as part of the iterative analysis process. We're going to see quite a few word clouds in the next few slides. I then spent some time investigating and searching for keywords. So keyword analysis builds on the word frequencies and word clouds to find common themes. Once the themes are known, we can then perform specific keyword and phrase searches to return the verbatim accounts from the PAUSE conversations. Next slide, please. So let's have a look at some insight. So this is from the social inclusion domain, and we can home in on the top 100 nouns that were mentioned in response to the question, what would you like to start in relation to social inclusion? This word cloud shows the results from the part of speech analysis. The most frequent word mentioned was community. You can see activities are important as well as relationships or perhaps doing things with neighbours, friends and family. Next slide, please. Next, we can have a look at some trigrams visualised here in a word cloud. This word cloud is based on the word frequency from the responses to the question, what would you like to start learning? And these responses were specifically from people who self-reported, so they answered the questions themselves. You can see that by analysing on trigrams, so 3 consecutive words, that this brings in a bit more context. So just to pick out a few, there's learning the names of birds, learn to play basketball, learn crafts, learn bank account, and so on. I think it shows that there's a wide variety of things to learn. Next slide, please. But with a more detailed look, I can start to see some groupings. I can see mentions of cooking skills, cut vegetables, learn to cook lasagna, learn different foods, learn to cook things. Could this be a signal or a theme emerging about an interest in learning to cook, bake, or try different foods? There definitely seems to be an interest in food, but is there anything else that can be grouped together? Next slide, please. So looking at the word cloud, we can also see learn things phone, learn computer, learn use computer, learn tablet. Could this suggest an interest in learning about digital technology? What if we try looking at nouns for the same question? If we were to pull out the nouns only, does this support the idea that there may be themes on cooking and eating as well as digital technology? Next slide, please. So here are the top 100 nouns for what would you like to start learning. You can see the words cooking, cook, meals and food. But you can also see computer, internet, phone and tablet. So this does suggest that we have 2 themes emerging, digital technology as well as cooking, baking and eating. Next slide, please. The information gained from the word clouds can then be used to perform a more detailed search through the qualitative data to try and provide more context and understanding. This slide shows a code snippet of how to create targeted searches on specific themes using a Python package called Spacey. This enables both keyword and phrase matching. It works by processing all of the text responses from the pause and creates a conceptual bag of words. This time I do minimal data cleansing and almost no text pre-processing. Spacey automatically tokenizes the text and at the same time adds metadata on the part of speech for each word. This allows me to only look at specific parts of speech, such as nouns or verbs if I want to. Building keyword and phrase lookups on our 2 themes, so digital technology and cooking and eating, returns the verbatim quotes from the people we support. These quotes provide a rich insight into the lives of people with a learning disability and can be used to support changes to their individual support plans or to help Mencap plan future campaigns. Next slide, please. So here are some examples of the verbatim accounts. Next slide, please. So why is analysing qualitative data from the pause helpful to Mencap? The pause conversations are primarily used to help improve an individual's quality of life, and it provides a measure that can be tracked over time. But the conversations also become a rich source of anecdotal evidence and insight that can also be applied at a community or societal level. For example, we have been able to take this evidence back to the people at Mencap who are running a programme that provides a laptop to people with a learning disability. They can use this insight to report back to their funders and demonstrate that the investment is worthwhile. We've also started discussions internally on the food and eating theme. A lot of the current focus on eating relates to safety, for example, preventing choking, but perhaps we could introduce more focus on the enjoyment of food, for example, by providing access to easy-read recipes that go beyond a simple sandwich. But perhaps at this stage, the most valuable output this exercise has provided Mencap with is one of curiosity. Being curious about using artificial intelligence to help reveal insight from unstructured data like text, and then applying the knowledge gained from this insight together with the quantitative data to support not just the individual, but also support campaigns and affect policy changes that aim to improve the lives of people with a learning disability. Next slide, please. So I hope that provides you with a little more understanding of how text analytics can be used to deliver insight. Thank you for listening, and I'll now hand you back over to Owen for questions and answers.
Hi everyone. So if you do have any questions, please do submit them. Mencap folk, if you'd like to come back, cameras. So, first time being a presenter in this way. Apologize if I get the pronunciation of your name wrong, Pega. But there's quite a couple. There was a few in from Pega. So towards Zach and Ellen, where can we find the POS tool itself? Can it only be used for learning disabilities? And how long is it advised between the first and second interview? And for context, that's from someone from Dementia UK.
And if I take the bit about the sharing of the tool, so I'm more than happy for us to share the tool for this. One of the things I would say, and I think Ellen made it really kind of clear, is that to use the tool, you do need to have the training, because part of the validity and efficacy of the tool is tied to that training, and it is important that if you're interested in it, come back and ask us about training, so we can kind of think about how that's something we could support with that. But yeah, I'm more than happy to share the tool with anyone following this. Ellen, I'll let you answer the other questions, if that's okay.
Yep. So to answer the first point about can it only be used with people with learning disabilities, that is where the sort of the research base lies and where it's predominantly used. There is an international working group. In fact, there's several streams of working group, and one of the working groups is looking at can the tool be used for other populations, or do we need a different tool? And the general consensus is that actually, as Zach mentioned at the beginning, quality of life is universal. So if we're saying that this measures the quality of life of people with a learning disability, then it should measure the quality of life of people regardless of what diagnosis they have. So like I say, there is more research being done in it, but the general consensus is that actually it's valid for other populations. There just isn't the research support behind it, I suppose. And then in terms of the second question, so the general advice is to leave a year between the first report and the second report, and so on. There's a couple of reasons for that. So one is that we don't want people working towards the questions. So a good example of that is that there's a question in the right section that says, can you have a pet? And if the person says no, they can't have a pet, we could easily make them score higher in the POS by changing their tenancy agreement so that they're allowed to have a pet, because now they will say, yes, I am allowed a pet. But that doesn't actually mean that their quality of life has gotten better. It means that we've worked towards the questions. So that's sort of one reason. And we think that in order to measure change, there needs to be at least a year between, because actually we don't know how sensitive the POS is to change, and we're completing a research project into that at the moment. But anything shorter than that, you're unlikely to pick up some of those changes in people's lives. Back to you, Owen.
Right, so I've got two questions, one from Robin and one from Jackie, that are thematically linked, and we'll be back to you, Ellen, I guess. So the two questions, I'll put them in their full. So how do you manage the issue of service user consent in order to analyze the data? And then subsequently from Robin, how are the interviewees identified? How do you access capacity consent? Are interviews conducted with a carer, helper, family member present?
Fab. So I'll take the second part of that question first for context. So the interviews, as Zach mentioned, there's the self-report and the report of other. And ideally, we'd do a self-report for people. But that doesn't mean that it has to just be the interviewer and the person being interviewed by themselves. It could be that that person wants to have a support worker with them, or a family member, or somebody to just help them to feel comfortable that somebody's coming to ask those questions. But as far as possible, we would encourage the person to answer the questions by themselves, and we would always take their truth. So if I was interviewing Zach and he said he followed a healthy balanced diet, and somebody was sat behind him going, we'd take Zach's view, because actually it's Zach's truth that we want. In terms of how people are identified, largely it's randomized, so based on area, and trying to get a spread of age, area and gender across the organisation. However, as Zach was mentioning, sometimes it is used as an intervention. So sometimes we use it to go and just have a chat with people where maybe there's been an incident, or we've got some concerns, or the person's maybe raised a complaint and we want to learn more about it. And we're actually looking at the moment at how we can link this work with the making safeguarding personal work, and bring some of people's views in to their safeguarding process using some of these questions. In terms of capacity and consent, so within the training, we do look at capacity and we do look at consent. And the app that Owen mentioned has got a capacity and consent process and a best interest process built into it. So when we're talking to people about collecting their data, we make sure that we're clear about how we're allowed to use it and whether we can use it internally, externally, and anonymously. So when the data goes to Gillian to do her text analysis, she doesn't get any of the information about who those people are. And we make sure that if people lack capacity, we're going through that best interest process to make sure that people's views are being heard in the right way, really. Does that answer? Sorry, Owen, there was a lot of points in those questions. Does that answer?
I think that covered those off. The nature of this platform means I can't see if people are nodding or shaking their heads, but we'll assume they're nodding. So question in from Robin Wilson, NHS. Are the dashboards intended to be public facing or for LA's, local authorities, internal view only? So at the moment, these are internal dashboards, but we are talking about how we can use this data in an open way. So one of my initial goals in this project was to produce a synthetic data set of the POS scores. I wasn't quite able to get it for what we wanted to do, but that is still an ambition. We are also using POS data in our evaluation and monitoring framework, which we do intend to open. Opening these kinds of things is new for us, but we are putting in place the foundations of it. I think the idea to share it with local authorities is a really interesting one. I don't know if Zach's got any thoughts on that. Nope. Okay. You linked with any other social care organisations and this, so mainly internationally. So there's the international working group, and Robin goes on to say that he works on, or she works on, adult social care surveys. And ASCOF, we could link up. Yeah, that'd be great. Love to see whether there's a link through into ASCOF, which, for the benefit of anyone else, is Adult Social Care Outcomes Framework, which is a data set published by NHS Digital. So another question about local authorities: are we engaged with people from local authorities using POS data? Ellen, do you know the answer to that one?
So we have been out to a few CCGs, local authority groups, talking about this work, presenting at Public Health England events as well, to try and get people interested in and on board. On a sort of individual level, we have used some of the information that we've learned from the POS or the POS scores to contribute towards people's individual reviews. So supporting people either to take those reports themselves or for us to use them to challenge maybe some of the decisions made at those panel meetings as
well. Okay, tricky one here from Lewis. How do you validate a scale of quality of life when there is no gold standard measure? I'll put that one forward to Zach.
Thank you very much. So could you say that again? My phone started ringing at the same time.
How do you validate a scale of quality of life when there's no gold standard measure?
So the tool itself has been developed in a rigorous academic model. So this tool is one that we didn't develop. Mencap don't own it. It belongs to Ghent University. And we deliberately went for one that was been academically developed. It has been tested in a number of different settings now. And at the moment we're funding, co-funding a PhD with University College London to look at its use in the UK. But an example would be in Spain. They tested and checked the validity of it, and the only reaction they had was they felt it worked, but they felt that they could reduce the question slightly, so they went from 6 in each domain to 5. So there's considerable academic research continuing around it.
And to follow up with that, Tim, can we provide literature references? Yes, we can. I can send those to you. Right, what else have we had in the presentation? How much pushback have we had due to the length of the session needed?
I'm happy to take that one. And I think this goes into two parts, really. So in terms of from the people being interviewed, very little. They, like I said before, they really enjoy this time. There have been some people where actually, and we always make it clear at the very beginning of the interview that we can take breaks if we want to. So there have been some people where maybe they've had their interview over a period of a couple of meetings rather than all in one go, and we can facilitate that. And I guess it's worth mentioning this doesn't have to be a formal interview. It doesn't need to be sat down, you know, in an office or in a room. We've done plenty of interviews in parks, walking around. I know Zach did one once where they played Pokemon Go and did the interview at the same time. I've done them in, you know, lots of different places that people feel comfortable. So I would say from the people being interviewed, we've had very little pushback at all. I suppose the bigger challenge, and it links back to what I was talking about around COVID, is that actually the workforce issues that we face can lead to pushback. So especially if the person does need some support to have that interview, finding 2 hours for a support worker maybe to support that person through that can be quite tricky, and we have to sort of work around that. But as COVID is easing, and hopefully as the crisis around workforce starts to ease, and that will become less of a barrier. I think what we've committed to as an organisation, and what the view of the board and the exec is that actually 2 hours a year to find out such rich information about people's quality of life and to make people really feel valued. And I think Zach's point about actually raising people's expectations isn't really a lot. And I would say, certainly from my experience of going to new interviews, they are just the best days of work, because you are just going out and spending time talking to people. And I'm always absolutely astounded by the amount of information that people share with me and are confident to share with me. And it always feels like a really privileged place to be. So yeah, I think although 2 hours a year sound 2 hours in one go sounds like quite a lot, if you think about it over 2 hours of the year and the impact it can have on people's lives, it's actually not a large amount of time at all.
Thanks for that. Have we got any more questions? If you do have any questions, then do submit them through, because we've almost walked away through the list. Thank you to Simone, and thank you to Jackie for the kind words. And at that point, with no more questions, I won't enforce my 7 seconds of silence rule before we move on. So I will hand over to Denise.
Thank you very much for your interest and participation and all the interesting questions. It's good to see that so many data analysts are taking an interest in improving social care. I'm hoping to see some of you on Future Care Capital's community of practice to tell us how we can help data professionals like you engage with other parties of interest. If there are any service providers and commissioners on this webinar, we would be interested to know how you engage with carers and people with lived experience of care. And it would be helpful to showcase this initiative from Mencap, as well as any other innovative solutions that you might come across on the community of practice. Thank you very much for attending, and I hope you found this inspiring.